With so many brands, types, and price points, how do you know which test is right for you? In the next few minutes, I'll guide you through what to look for, the differences between tests, and how to get the most accurate results. First, let's talk about how pregnancy tests actually work. All pregnancy tests detect the hormone HCG, which your body produces after a fertilized egg implants in your uterus. The levels of HCG rise rapidly, and most tests can detect it as early as 10-14 days after ovulation. But not all tests are created equal, and understanding the differences can help you choose the one that's right for you. When it comes to pregnancy tests, there are two main types: over-the-counter urine tests and blood tests done at a clinic. For most people, the focus is on at-home urine tests. Let's break them down. Number 1. Digital tests. These display a clear result like pregnant or not pregnant. They're user-friendly but often more expensive. Number 2. Non-digital tests. These use lines or symbols to indicate results. They're typically more affordable but can sometimes be harder to interpret, especially if the lines are faint. Number 3. Early detection tests. Some tests are marketed as early detection and claim to identify pregnancy up to 6 days before your missed period. While they're sensitive, keep in mind that HCG levels vary from person to person, so they may not always give accurate results that early. Now, let's talk about what to look for in a pregnancy test. When choosing a pregnancy test, here are a few things to consider. Look for a test with a sensitivity of 10-25 unit per milliliter of HCG. The lower the number, the earlier it can detect pregnancy. If you prefer a no-fuss experience, a digital test might be the best option. If you're comfortable interpreting lines, non-digital tests work just as well. Stick with reputable brands that have good reviews and are FDA approved. Some popular options include Clear Blue, First Response, and EPT. If you're testing frequently, consider a cost-effective option like test strips, which are just as accurate but come at a fraction of the price. Now that you know what to look for, let's talk about how to use a pregnancy test correctly to ensure the most accurate results. Read and follow the instructions carefully. Different brands may have slightly different steps. Test first thing in the morning, when your urine is most concentrated. This is especially important if you're testing early. If possible, wait until the day of your missed period for the most reliable result. Testing too early might give a false negative. If you get a negative result but still suspect you're pregnant, test again in a few days or consult your doctor for a blood test. While finding the right pregnancy test is important, remember that it's just the first step. If you have questions about your results or are unsure what to do next, reach out to your healthcare provider. They're there to guide you. I hope this video helped make choosing a pregnancy test a little less overwhelming. If you have any questions or favorite test brands, share them in the comments below. I'd love to hear from you. Don't forget to like, subscribe, and hit the bell icon for more expert advice on pregnancy and women's health. Thanks for watching, and I'll see you in the next video.